OsteoCare, growing our community in the pursuit of excellence. OsteoCare has built on its ethos of making implant dentistry accessible to all. Through decades of precision engineering, design, research and development, our brand has become synonymous with quality. OsteoCare is proud of its British heritage and for many years has been providing quality implants, instruments and prosthetic components. The OsteoCare team is made up of a very experienced group of people, and we're focused on evolving products that we sell today and developing products that we want to sell tomorrow. Our vision is to develop and support a network of like-minded individuals who share the same passion in the pursuit of excellence.
A&B Engineering was formed in 1974, over 40 years ago, by John Gould, and since that point he's been putting together a team of the best engineers that he could find, and he's grown the business to what it is today, where we work with many sectors, some blue chip companies in aerospace, oil and gas, nuclear and the medical sector. About 20 years ago, some of the pioneers of implantology came to John with prototypes and sketches, just looking for a manufacturing company. John always went beyond just manufacturing and would give his feedback on the designs, learnt from them about what they were trying to achieve, and he found that he enjoyed using his engineering skills to produce new products which he could see helped people, and it gave him a great sense of personal satisfaction. And from that point onwards he became hooked on implantology, and OsteoCare as a company was formed. So since the formation of the company, A&B and OsteoCare have worked in partnership, with A&B providing all the engineering expertise. The implants are manufactured using a lot of complex equipment, a lot of bespoke tooling, a lot of tooling that we design ourselves. The fact that we design our own tooling gives us an edge in producing shapes that some companies may struggle to produce.
OsteoCare operates stringent quality and contamination controls to ensure that our implants are delivered to the dentist in premium condition. We apply the highest standard of clean room assembly and packing to achieve sterility assurance. Through innovation, total commitment to quality and working with our customers, we've developed an all-encompassing system, ideal for the general dental practitioner through to the experienced implantologist. OsteoCare has demystified the perceived complexities associated with implantology by purposefully engineering an uncomplicated and easy-to-use implant system.
When I trained at dental school many years ago, implants were just being introduced to us more on a theoretical level. Therefore, my perception of implantology was one of complex, big oral surgery, and I never ever thought that I would be able to introduce implants into my practice. However, having attended the OsteoCare introductory seminar, I realised actually, hang on a minute, I can do this. I'm a general dental practitioner, I'm a confident surgeon, I don't have to worry about the complexity, I can do this.
I have been using OsteoCare since 2008. It's a simple yet versatile implant system. It's a high quality and reliable system. It allows for flapless procedure which are less traumatic to the bone, less invasive for the patient, which also reduces the surgery time and the post-op discomfort for the patient.
Being a dentist, I think my main concern is working to improve my service to my patients. I thought as the best replacement for the missing tooth will be dental implants, to stop the need to suffer with dentures, stop preparing or over-preparing the teeth to hold a bridge, and so decided to go with OsteoCare dental implants.
I find OsteoCare dental implant system a remarkably high quality system to use. I have had no issues in all the years that I've been doing the implants, no flaws. It's been incredibly, remarkably cost effective and yet excellently made. And to top it all off, it's British made.
As an all-encompassing implant system, OsteoCare offers predictable simplicity.
As a dentist, I want to keep it simple. I don't want lots of tools and complications, and this is what OsteoCare provides. You can use it for simple placement of implants, but you can actually use the system for quite complicated treatments as well.
OsteoCare offers a versatile dental implant system with an extensive product range designed for a broad spectrum of clinical scenarios. Every aspect of implant placement has been rethought and simplified. Patients can be treated expertly and cost-effectively in general dentistry.
I would recommend OsteoCare to anyone who is looking for a simple, versatile and cost-effective implant system with great support and reliability.
Through its training centre in Cairo, OsteoCare offers unbeatable hands-on training with multiple implant placement on live patients.
OsteoCare was very appealing to me because the initial intensive course was 5 days, and in those 5 days you were then able to actually place implants confidently, which for me was incredibly impressive because I didn't find any other course anywhere else in the UK that was able to give me that opportunity.
It was an absolutely brilliant course with an extensive hands-on element, and I actually succeeded in placing 15 implants on live patients, which is far more than any other implant course was offering at that time.
OsteoCare is committed to helping implantologists develop their skills and practice by providing support, training and a product that is simple and easy to understand.
Done about 120 implants as a group on 5 days, so you could imagine the amount of knowledge and information you get, the experience you get. Plus, there is a big help from the Professor Amr Zahran, who's giving the course in Cairo.
Professor Zahran was absolutely astoundingly brilliant, excellent teacher, and everyone came away from that course feeling ready and driven actually to place the implants. And when I got back to the UK, I immediately started planning and got straight to it.
OsteoCare products have provided smiles to patients for decades, improving appearance, functionality and self-confidence.
I now feel I've got a tooth which actually belongs to me as it was before, and over the 5 years that I've had the tooth I've experienced no problems whatsoever.
Well, I was quite worried really, thinking what am I doing? But I've got to say it's the best thing I've ever done. But I remember you saying to me, right, I'm putting them in, and I thought, and you said they were longer than my other teeth, and I thought I look like Bugs Bunny. And that minute when you got the mirror, I was really apprehensive, thinking, oh, and then I was delighted, so I've been delighted ever since, which is why I'm here. I won't be doing this video otherwise.
For me, having the dental implants was really important because I'm not old, and I didn't really want to spend, the rest of my days with dentures. So for me, it was quite a big deal.
I remember I went to work the day after I'd had them done, and someone who I'd worked with for quite a few months, she said, "Oh my God, your teeth are perfect." And I actually didn't realise how perfect they now looked. It was quite astounding really that somebody you work with had noticed something like that.
Well, I didn't want a gap between my teeth, and I'd heard about them and I'd read about them here, so I thought I'd ask you and give it a go, and I've never looked back. In fact, I wish all my teeth were dental implants. I really do.
OsteoCare, growing our community in the pursuit of excellence.